Hello, my name is Adedoyin Adekoya, and I'm here to present Healthcare Implementation System. Implementing Computerized Physician Order Entry, CPOE. Now let's talk about the definition of RFI and its role. RFI is a formal document used in the system selection process to gather information from potential vendors. It helps in understanding vendors' capabilities and offering, aiding in decision-making process. Content included in an RFI for a CPOE system. We have the hospital background and current system. There's requirements for CPOE system, that is the remote access. We have vendors, qualifications, and experience. We have the cost consideration, and of course, the implementation timeline. There's also support and training options. Consideration for upgrading existing system. So there's advantages and disadvantages of upgrading the current system. We can have impacts on workflow and staff. We have to look at the cost implications and also the scalability of the current system to accommodate future growth and technological advancements. Consideration for implementing a new system. We have the advantages and disadvantages of implementing a new system. There's potential for benefits for a new system, that is improved functionality, integration, and we have to look at the cost implication, evaluate potential vendors and system, implementation challenges and strategies for overcoming them. Ensure that the new system aligns with the industry standard and best practices for health informatics. Now, what are my recommendations? Based on the scenario provided, I recommend implementing a new system rather than upgrading the existing one. And why do I say so? These are my reasons. We have to think about compatibility, future scalability, advanced features, future proofing, integration with existing systems, user experience and providers' preferences, the cost effectiveness. Implementing a new system for CPOE can address the hospital's current needs while also setting a foundation for future growth and technological advancements. It makes it a very strategic long-term investment. So now let's look at the relation of RFI to system lifecycle model. Number one, initiation. RFIs are typically issued during the initiation phase to gather information about the available system and vendors. We have the planning, number two, planning. Information gathered from RFI helps in planning the implementation for the new system or the upgrade of an existing one. Three, we have execution. RFI aids in selecting the right vendor and system implementation. Four, we have monitoring and controlling. RFIs help in monitoring the progress of the procurement process and controlling the quality of information gathered. Now let's talk about the application of RFI. Now, we have the applicability to healthcare practice. RFI helps in selecting a CPOE system that improves patient safety. That is number one. Patient safety, that's our key. It reduces medication error, whereby it enhances the overall healthcare delivery. It allows for integration for CPOE with existing system for better workflow management and efficient patient care. Let's look at the applicability to education. It educates all hospital staff about the features and the benefits of different CPOE systems. It also helps in training programs for a new system, ensuring a smooth transition and minimal disruption to education. Now let's look at applicability to administration. It assists hospital administration in making informed decisions about system upgrades and implementation. It also provides a clear understanding for financial implication and return on investment for each option. Now let's look at applicability to research. It supports research efforts by providing information on how different CPOE systems can be used for data collection and analysis. It enables research into the effectiveness of CPOE in improving patient outcome and healthcare efficiency. Now, what is my conclusion? My conclusions goes by implementing a new system aligns with the best practice in healthcare informatics, whereby it ensures that the hospital's technology infrastructure meets the current and the future needs while providing seamless, user-friendly experience for provider and staff. It makes the transition very seamless and it doesn't disrupt any workflow. It is user-friendly and it advances as technology advances also. So this is my conclusion that I will go for implementing a new system to provide the best practice in the hospital. So let's look at my references now. So my references are, we have Amiri P. Rahimi B. and Kaliki HR 2018. The determinant of successful implementation of computerized provider order entry. CPOE systems from physician's perspective. Feasibility study prior to implementation. We also have Charlotte D. 2020. Requests for information. And part of my references are Hatila H, Hapasalo H, and Sivola R, 2020, Managing Data Flows in Infrastructure Projects, the Life Cycle Process Model. And we have Kenan R. Brodsky, EM, and Koshnik A. W. 2021, Computerized Provider Order Entry and Patient Safety, a scoping review, Knowledge Management and e-learning. We also have Yashnov WA 2021, health information infrastructure in biomedical informatics, computer application in healthcare, and biomedicine. The Springer International Publishing. So this concludes my presentation on implementing a new healthcare system. Thank you.